drawing, or any other activity that helps you be present. And we would love for you to please introduce yourself in the chat using your name, town, and pronouns. And we do ask that you please keep your microphone muted unless it's time for questions or you're asked to unmute it. If you do have questions or something to say that relates to the topic that we're talking about, you can go ahead and use the raise hand function that's located in the reaction menu. And other questions not related to the material tonight, those can be written in the chat, and we're saving the chat so we'll be able to get back to you with answers if we can't answer them right away. And one last thing is that we have enabled closed captioning or live transcript. So if you go down to the bottom of your screen, you'll see an icon that says I believe it says live transcript or CC, and you can click on that and it'll give you some options. Okay, now I'm going to talk about rights and democracy. The Rights and Democracy, RAD-C4, and the Rights and Democracy Institute, RDI-C3, work across Vermont and New Hampshire to advance human rights and a healthy, just, and equitable future for our communities. RDI's leadership development programs and issue-based campaigns encompass a range of organizational and movement building work, including economic, education, and racial justice, as well as universal health care, climate justice, and childcare access. I'm going to speak briefly about three of our main campaigns, and we're working on these in the coming year. This is not an exhaustive list, as we may pivot or adjust along the way. The first is Medicaid expansion. We are working to advance in-state efforts to win healthcare coverage and access for more people while strengthening public health insurance systems. Our Barriers to Medicaid survey was released earlier this month, and it provides a guidework for our work in this area. There are current bills regarding Medicaid services and access in the New Hampshire State House that we are working on to help move forward. Later in our meeting, we will talk in more depth about these bills and our work. Lower drug prices now is our next campaign, and we will advocate through our federal delegation to take necessary executive action, AKA compulsory licenses, to lower drug prices. And we will be amplifying stories of Granite Staters who have been harmed by the high drug prices via education materials, events, and meetings with those elected officials. Our Care Over Cost campaign is the third, and this campaign reveals the failures of the private insurance industry, and it builds a base of people impacted by them. Medical bills will continue to cause more than 500,000 personal bankruptcies each year, and claims denials are a key factor in that. To give you a more detailed idea about what we're doing for this campaign, I'm going to turn the mic over to Jody Newell.
Thanks, Marcella. So I'm going to be talking about the Care Over Cost campaign, of course. We are going to put in the chat the Kaiser Family Foundation's issue brief, which we draw a lot of this information from. And then also Heather Stockwell had an op-ed published talking about her experience with this as well. That's really important to read. So we'll put those in the chat so you can read them at your leisure. In a nutshell, the Care Over Cost campaign is an anti-corporate campaign focused on insurance companies' claims denials and bad practices. We believe that in order to get a universal healthcare system, we must continue to point out the actions of the corporate bad actors and hold them accountable. The campaign demands that big issue insurance providers are held accountable for their practices that keep people from getting the care they need and capping out-of-pocket expenses as well as premium costs. Blue Cross is one of the largest affiliates in our country and one of the most profitable for its shareholders. Other insurance providers, of course, use the same practices. So the national average for in-network denial averages out at 17% and has ranged from 15 to 20% nationwide. Sorry, of course someone calls me now. Nationwide, 50, I'm sorry, let me start over. Our national in-network denial rate averages out at 17% and range from 15 to 20% depending on the state. This number represents over $40 million in profit for the company and its shareholders. The New Hampshire rate is a whopping 31.9%, which is almost twice the national average. And New Hampshire also has some of the highest premium rates in the country, making it more difficult for everyday people to afford. So it's important to look at what are the reasons for these claims denials, right? 18% of plan reported denied claims were denied because the service was not a covered service. 9% of plan reported denials were because the claim lacked a required referral or pre-authorization. Fewer than 1% of plan reported denied claims were denied on the basis of medical necessity. 72% of denied in-network claims were denied for some other reason, indicating that there is more to learn about why plans deny in-network claims. Federal transparency reporting on denial of out-of-network claims does not provide meaningful information at this point. Plans are not required to report the total number of out-of-network claims submitted, so a denial rate for out-of-network claims just can't be calculated based on our data. Denied claims, consumers rarely try to appeal denials, right? Denied claims not appealed represents 99.8%. Denied claims that were appealed, which we call first level appeals to the issuer, are 0.2%. This represents 40.4 million in denied claims appealed by consumers in 2019 through internal issuer appeals process. Issuers uphold most denials that are appealed. In 2019, about 40% of denials that enrollees appealed internally to their health plans were overturned. The overturn rate of appealed claims denials varied by issuer. The Affordable Care Act established statewide consumer assistance programs to help consumers file appeals for denied claims. These programs were established in most states and territories in 2010, and 36 remain in effect, but they have not received federal funding since 2012.
I just want pizza now.
Pizza. Sorry. All right. Hold on. All right. This is why we, the people, must stand up, tell our stories, and expose the practices of these greedy corporations and hold them accountable. And so one of the things that we really focus on is sharing people's stories, right? And so in order to kind of model that, what I'd like to do is share my own story of a claims denial. So a little over 3 years ago, the night before Thanksgiving, I shattered my right wrist in a serious fall. I was visiting with family in Massachusetts, so my mother brought me to the closest ER where they stabilized it for the time being and sent me off with instructions to seek further care. When I returned home 3 days later, I found that a pipe had burst in my kitchen and had been spewing water over the entire first floor of my home for days. There was over a foot of water in my basement. It was a complete disaster area. 2 days later, as we showed the insurance inspector the damage, my dad, who had driven up to help us, received the phone call from my mom saying that she had found my brother unresponsive. He had died that morning. Now, I understand that these other things sound somewhat irrelevant to the subject at hand, right? Because we're talking about medical insurance. But my intention is to convey that we are human and we are all dealing with so much else in our lives. And I anticipated a fight with a homeowner's insurance company, and boy, did I get it. What I did not anticipate was a fight with my health insurance company. While I was aware of claims denials, I felt secure in that I had good health insurance through my work. I sought care through my primary care provider. The hospital checked coverage before surgery was scheduled and rechecked it the day of. Even in my devastated state, with the help of family and the amazing team at Cheshire Medical Center, we had done everything by the book. We crossed our T's and dotted our I's, and yet still, a month after the surgery, I received the bill. Blue Cross Blue Shield had decided that over $7,000 of this claim was my burden to bear. So for 2 years, my mother, who was the bookkeeper at my work at the time, and our insurance agent made call after call trying to sort out the situation. None of us had any idea why it was denied, and nobody seemed to have an answer for why. Now, I was incredibly fortunate in that at the end of the day, after this 2 years, I was finally able to reach the right person to correct whatever this coding error, I still don't know, had occurred, and resubmit my claim successfully and have my work and family help me cover the remaining deductible. But from this experience, I do know how hard I had to fight, the hoops I had to jump through, and the time I had to invest. Not everyone has that time, awareness, or support. So we're doing this work nationally with our partners at People's Action, and we're also teaming up with the Patient Advocate Foundation on this campaign to help support the appeals process using their amazing skill and experience. And so we're also going to share this link in the chat right now for the Patient Advocate Foundation, and so that people can reach out to them if they're having an experience like this. Is there, does anyone have any questions based on what we've talked about so far? All right, well, if there aren't any questions right now, I'm going to pass it right along to Beverly for an action break.
Well, hello. I just want to thank Jody for sharing that powerful story. That was quite a story. And I believe that, I don't see it on the screen, my screen anyway, but there is going to be a provision provided, which I'm going to talk about now on the RAD website, for you to complete a survey. And this survey directly relates to sharing stories. So sharing stories has shown to be an effective way of networking and organizing. And our Rights and Democracy Healthcare Justice Team is committed to bringing people together in New Hampshire and nationally to make a difference. As we fight for a future in which every single person in our communities receives the healthcare they need. Powerful health insurers continue to raise premiums and deny claims. While millions of us face ever worsening access to care and struggle under the weight of medical debt, big corporations like Blue Cross Blue Shield, which insures 1 in every 3 Americans, continues to see their profits grow. This is not right. So if you have a story, we want to hear from you. Below or in the chat, I believe there will be a link to a survey which will enable us to contact you about your story. It is a simple form which allows you to tell us a little bit about your experience with healthcare insurance. We appreciate all the information we can gather to strengthen the case we have for expanding, increasing, and simplifying access to the healthcare we all deserve. So in this petition, there's just a little bit of information about your contact information and a few questions about your healthcare, whether you have healthcare, whether you've been denied, but it would probably not take too long to fill out. And once you've done that, you're basically giving us permission to contact you. One of the healthcare team leaders will contact you to talk to you a little bit more, because gathering these stories will gather the organizational and the power and the strength that we need to effectuate change. And I really appreciate everybody listening. Thank you.
Thanks, Beverly. I think right now I think we were going to give people a few minutes to fill that out, but we could also, so we can take a little bit of a break, hear our song again, and then we'll jump right into the Medicaid barrier stuff. Or are we ready to go? I think we have a small enough group that we could keep going. Jonah, you look ready.
I think we're ready to go. So yeah, thanks, Beverly. I mean, I'm here to talk about the second campaign that we're doing, which is the Medicaid Expansion. In 2021, the Rights and Democracy Institute, or RDI, surveyed New Hampshire Medicaid users to learn about barriers they faced in applying and in maintaining coverage. We released a report with our findings on February 1st in collaboration with our national partners, Center for Popular Democracy. Lynn will be sharing some links in the chat which include the New Hampshire report, our website, the video to the event, sharing that report, and then some articles to like the NH Bulletin, an NHPR article, the Concord Monitor article, and some others, which include some analysis on that as well. Some of the highlights that we found in that report included 59% of respondents experiencing enrollment challenges, common barriers, including burdensome paperwork and experiences of frustration, fear, and stigma. Respondents of color were over twice as likely to report shame and stigma as white respondents, 36% to 16%, respectively. Respondents of color were more likely to say that they were dissatisfied with the process, and again, 42% to 48%. And while these issues can't be solved overnight or with the wave of a magic wand, we are now aware of them and can work to change our systems to make it less cumbersome to apply. And with that said, I'm going to transition to talk about a few pieces of New Hampshire legislation in the State House currently, which would expand services and eligibility for Medicaid users. The first of that being the Medicaid dental bill, which would expand dental services for adults. These are it's two bills, HB 103 and SB 422. The Senate bill in the House, of course, and then the House, the Senate bill in the Senate, and then the House bill in the House. These would add adult dental benefits for all New Hampshire Medicaid system health insurance plans instead of emergency tooth extractions as a solution. The second piece of legislation that we're talking about is the Medicaid Immigrant Justice Bill, otherwise known as HB 1578. This would expand Medicaid to more categories of immigrants. This bill would include certain children and pregnant people in Medicaid and the Children's Health Insurance Program. That's again sponsored by Joe Shapiro. And then the last bill that we have is HB 1536 and SB 407, the two bills, again, sort of similar bills, but in the Senate and House. It's known as the Healthy Moms, Healthy Babies Act. That's what the representatives and senators are calling it. The act itself expands Medicaid to include certain postpartum health services. Currently, postpartum care is only covered for 60 days after childbirth, and this legislation would add coverage for the whole 12 months. So that wraps up my piece. And if you have any questions, feel free to put them in the chat, and we will definitely follow up with you afterwards. And with that, I will hand it off to Heather for another action break.
Thanks, Jonah. Yeah, I might just use these slides for a second and take us back, because right now we're here. But I want to talk about where all these bills are at. We've most of the bills that we're talking about tonight have already had a hearing of some sort, so it may be too late to sign in support or oppose the legislation, but not all of them. So we're going to talk a little bit about that and what is possible right now. As probably most of you who are on this call tonight understand that our state government is Republican controlled, and the likelihood of some of these things passing well is small on some level. So what happened, what has happened today is, let's see, I'm going to give you some updates. I have it here. I have it here. Right now, HB 103, which is the House dental bill, that has that's currently in a finance committee, in Division 3 Finance Committee. So right now, it would be awesome if people wanted to write to that finance committee. I think that Lynn might have that link that she can throw in the chat for folks, and that'll direct you to the Gen Court website. And there's an option on the right-hand side there where you can email the whole committee. And it's the Division 3 committee. Right now, that's where it's at until at least the 24th of this month. So, and then after that, it will go to the full finance committee until approximately the 31st when crossover happens. If you do want to want to advocate to, you know, with that finance committee, definitely some recommendations is to keep your testimony maybe less story oriented, because what they are really focused on is the finances, is where the money is coming from, and you know, how are we going to pay for it. So it'd be really helpful to get to know where the financing is coming from, and how, you know, how they're seeing this whole thing. I'll get a little bit more into that in a moment. Let's see, 422, I believe, passed the full Senate today, which is super exciting, 24-0. That is kind of amazing to me. Not often that you see the full Senate voting in unison like that. So I know they've been working really hard on that. We do have a talking points memo from or a document from the New Hampshire Oral Health Coalition that we could also be happy to share with you as well. But again, right now it's really about the finances. So next piece is this bill, 1578, which Jonah explained would open up some categories of people who have immigrated here and their children, or if they're pregnant, it would cover them and their children through the Medicaid system, as well as the CHIP program. This bill did not do very well in committee. It the majority voted to not to what is it? ITL.
Inexpedient to legislate. Right?
Thank you. Thank you. So the pathway is pretty slim. We'd still love people to reach out to their reps in the next 24 hours if possible, and let them know. Send them an email tonight. Tell them why you support this piece of legislation. There are many reasons to support this. People that are just coming to this country are definitely might be struggling. I'm not going to assume that, but that's a really big move for folks to be making, and having some health care to help them along would be a really good idea in my humble opinion. But I'm going to move on to the next one. Basically, before we go on though, we also have a talking points doc from Joe himself, just talking a little bit about what his bill would do. And basically what will happen when the House meets, I think tomorrow, they'll vote on whether to accept that committee's recommendation. And so if the House were to say, no, we don't accept that, we think that this should get heard, then it has a possibility of moving forward more. And we'll see where that gets to. We'll know more tomorrow. The last two bills are the postpartum expansion bills. And again, with this scenario, the House looks pretty unlikely that House bill is going to move along any further, whereas the Senate bill is doing really well. Again, that bill, SB 407, the Senate postpartum bill, or Healthy Moms, Healthy Babies, that's also now heading to the Senate Finance Committee. So we're asking folks to definitely reach out to folks on that committee. I don't know if we have a link ready, but we can add that to our follow-up communication with y'all. What we would love people to do tonight, and I'm not sure if it's gone into the chat yet, but we have a Medicaid expansion petition. We hope you'll sign this petition, saying that you support these efforts to expand Medicaid for people in the state of New Hampshire, and we want to update you on where the bills are at. Right now, we're in kind of a wonky place, having two major bills that we're supporting in finance committees. So but it's not maybe going to always be there. So we want to keep in touch with you about that. And also just that we're really thinking ahead to next year, and next year is the 5-year point where we will need to reauthorize our Medicaid expansion program. So in 2018, we did extend it for another 5 years. And we want to keep it going. I don't want to get in the weeds about this. There are some issues with how that was decided to be financed this last time around, and that will certainly come out as we get planning for next year. I think that's all I have, folks, and I am going to turn it over to, who am I turning it over to? Marcella. Oh yeah, any other questions before we move on? I know that was a lot. So I'm gonna take it off share and just like, let's be together in this room together. And I am going to view this as a gallery, so we're more like a group. Any other questions before we get going on? Moving on. I'm not seeing any hands or waving or anything. Please go ahead and, like, we're a small group tonight, so Dave, you got a question, or are you just doing some jazz hands?
No, I'm just waving.
All right. Yeah, you can go ahead and come off mute if you have a question. We don't have a humongous group tonight, so. And if not, we're gonna move. I'm gonna just pass it right over to Marcella again.
Does Dave have a question?
Excuse me. No, I was going to just chime in a little bit and ask, like, it's just a pretty small group tonight, and I'm just like doing my homework behind the scenes and looking at where it's going. And this is stuff we want to get right out. Is this stuff that can just be streamed out later this evening?
We did not live stream this one because it's our first one of the year. But in the future, that might be something that we do. I can see how quickly we can turn this around, but it won't be tonight.
Okay.
Generally, what happens is our communications team will take this and what I
Yeah.
call ratify it. See what I
Okay.
did there?
So I could turn it around tonight if it were desirable, but we should talk about this in the future because I can just hot stream it straight out to a few other locations as we go. And I just did this for the climate. That wasn't the climate people. It was the peace activists had their stuff all crash, and I just ended up streaming a whole bunch of stuff just for them. So I just wanted to check and kind of open that up because it seems like this is the choir a little bit, and I just want to figure out what are the action item, what I can really do to
Yeah, totally.
help.
Totally.
So,
Appreciate that. We'll share those links out for the Medicaid petition and the healthcare survey. That would be super helpful right now. Next month, we are planning to really launch our Care Over Cost campaign, which is what we talked about before. So we'll have more details about that. But we are looking for more storytellers right now. I had my own story. Jody shared her story tonight. And for that campaign, it is going to take more and more stories to illustrate that this problem isn't just one or two people, that this is a systemic problem. If almost 32% of people in New Hampshire are being denied care, and 72% of those denials are for some other reason besides not being in network or not having the right code, things like that have been, data's been collected on those things. These other reasons aren't specified, right? They're kind of feel random, I think, for many who are struggling with something like that. Did that answer your question? But yeah, I appreciate that. But let's also follow up offline, Dave, and talk more about how we can work together to get this out.
yeah, absolutely. Yeah.
Cool. And I see some friendly faces here. Bobby Williams, Jimmy Cottrell. I know both of you.
Nice to
And
see
Mark.
you.
Yeah, it's great. Thanks for coming. It's great to see you. And Jimmy, we haven't seen you for a while. And Mark, I feel like I have seen you on other calls before, but welcome. And Nancy, I feel like I recognize your name as well. If there aren't any other questions, I'm going to move on and let Marcella do our evaluation tonight. We so appreciate you coming tonight and engaging in our healthcare work. We're really, I think we're all really excited about what we've already accomplished this year. I mean, just the fact that we released that report a couple weeks ago, and the press actually paid attention and wrote articles was really exciting. So we are raring to go this year. So check all that out, and we will. The other thing is we'll follow up with a big long follow-up email with all of these links and stuff. And also feel free to forward. I'll put that out probably before noon tomorrow, Dave. So if you want to share that follow-up email with folks that you're in network with, that would be super helpful too. All right, Marcella, you're next.
Fantastic. This really flew by. Yeah, so again, as Heather said, thank you for coming tonight. And before we wrap up, again, if you have any questions that were not answered, they can go right into the chat and we'll be back in touch, as Heather just said. Heather's email is heather@radnewhampshire.org. And I believe that was also put in the chat, but I wanted to reiterate that. And I also apologize, my dog is losing his cool right now. So I want to invite you to help us close out this meeting. And I'd like you to think about what you've heard tonight and how the information has impacted you. And if you could share one word in the chat that describes how you're feeling, or an action or an idea that you would like to get working on, we would love to hear your feedback or ideas. Just a really nice way to kind of close it out and see how everybody, take the temperature, see how everybody's up to. And I want to thank you again for being part of our meeting. And just a reminder that our next public meeting will be on March 16th, and that is from 6 to 7 p.m. Thank you very much, everybody. I'm seeing some great words in the chat. I'm seeing Lynn saying that she's grateful for all of the fine work. Beverly is thanking Fiona. Heather said motivated, and Jody said that she stole that from her. And I'm going to say y'all stole that from me, but this is really exciting. Let me keep catching up. Beverly is hopeful to make a positive that we can make a difference. Dave is ragey at the man, and I can totally feel that one. I'm also ragey at the man and the House of Representatives a little bit. I guess they are the man. Yeah, so keep them coming. It'd be great.
Thanks, Marcella. Marcella, I just called you after a dish instead of your name. Marcella, I'll get it right. Yeah, thanks again for coming. I'm going to close us out with the rest of this India RE song. And yeah, thanks so much for coming tonight. We so appreciate all of you. And we like to dance too.
Every freckle on my face is where